Welcome to Dr. Nancy's Daily Bytes. Recall question and answers, Neet MDs 2022, Part 2. Renal tubular function is best assessed by plasma urea, urea clearance, plasma electrolyte, plasma uric acid. Answer: plasma uric acid. Occurrence of new carious lesion is assessed by chi-square, paired T, unpaired T, ANOVA. Answer: chi-square test. A 10-year-old patient reports to the clinic with pain and swelling in the lower left back tooth region of the jaw. IUPA is attached. Best treatment advised is pulpotomy, extraction, pulpectomy, IPC. That is indirect pulp capping. Answer is extraction. G6PD deficiency causes which of the following? Aplastic anemia, hemolytic anemia, megaloblastic anemia, sideroblastic anemia. Answer: hemolytic anemia. Identify the following defect is shown in PSP plates. Light streaks, double images, crimp marks, improper placement. Answer: double images. It may also be caused due to improper cleaning of PSP plate. Unilateral recurrent laryngeal nerve palsy causes which of the following? Complete loss of speech, hoarseness of the voice, loss of timbre of the voice, none. Answer: hoarseness of the voice. A patient visited the clinic with the chief complaint of replacing her missing teeth. On examination, bony projections were seen on the lingual surface of the mandible. Which forceps should be used? Ronger forceps, Stille Ruskin ronger, Luer ronger, Leksell ronger. The regular ronger forceps is the answer. A known cardiac patient had difficulty in swallowing. The left atrium is dilated. Which of the following structure is compressed? Esophagus, pharynx, trachea, larynx. Answer: esophagus. Beta oxidation of odd chain fatty acids produce succinyl-CoA, acetyl-CoA, malonyl-CoA, propionyl-CoA. Answer: propionyl-CoA. Marker for cardiovascular disease is albumin, C-reactive protein, haptoglobin, ALP, that is alkaline phosphatase. Answer: C-reactive protein, or is called as CRP. Deciduous central incisor was intruded. IUPA shows elongation. In which direction was the tooth displaced? Here you can see both intrusion and elongation. So the options are palatal, labial, mesial, distal. Answer is palatal. Most aesthetic among the following: lithium disilicate, PFM, zirconia, monolithic zirconia. Answer: lithium disilicate. Which of the following has astringent potential? Zinc chloride, tranexamic acid, thymol, glycerin. Answer: zinc chloride. A 45-year-old patient presents with firm, painless, soft cystic swelling on the right side of the face anterior to the ear, with no fixation to the overlying skin, which is growing slowly since 7 years and now it has reached the current size. Biopsy is taken and sample is sent for analysis. On histological examination, neoplastic cells are arranged in ductal pattern, sheets and islands. Stroma is delicately collagenous with myxoid areas, and few cells shows vacuolar degeneration and are chondroid in appearance. The chromosome is AQ12. So what is the diagnosis? Wharton's tumor, pleomorphic adenoma, basal cell carcinoma, canalicular adenoma. Answer: pleomorphic adenoma. Retinal cells are glued together by Muller cells, horizontal cells, amacrine cells, ganglionic cells. Answer: Muller cells. An old female patient wants to get rid of wrinkles. Which of the following statement is true? Neurotoxin used for surgical cosmetic management. Neurotoxin used for non-surgical cosmetic management. Neurotoxin is a type of chemical peeling. Neurotoxin increases the volume of bone lost. Answer: neurotoxin used for non-surgical cosmetic management. Identify the following image which contains self-actualization, esteem needs, love and belongingness needs, safety and security needs, and physiological needs. Options: Freud's topographic model, hierarchy of needs by Maslow, cognitive theory of Jean Piaget, and Erik Erikson model. Answer is hierarchy of needs by Maslow. Weiny's classification type 2 is 2 orifice, 2 canals, 2 foramina, 1 orifice, 2 canals, 2 foramina, 2 orifices, 2 canals, 1 foramina, and 2 orifices, 1 canal, 2 foramina. Answer: 2 orifices, 2 canals, 1 foramina. According to Tsuchihashi classification, branched pattern of lip print come under which type of lip print pattern? Type 1, 2, 3, 4. Answer is type 2. Upon examination of the patient teeth, there is greenish color discoloration seen on all the cervical thirds of the tooth. What is the most common cause of this condition? Amelogenesis imperfecta, tetracycline staining, dentinogenesis imperfecta, chromogenic bacteria. Answer: chromogenic bacteria. Which of the following are anti-apoptotic genes? BAX, P53, BAK, BCL2. Answer is BCL2. A 24-year-old female patient is on tuberculosis regimen. She takes the oral contraceptives, but still she becomes pregnant. Which ATT drug might have led to this condition? Isoniazid, pyrazinamide, rifampicin, ethambutol. Answer: rifampicin. A patient presented with multiple radiolucencies in maxilla as well as the mandible, and the lesions are pathognomic to chest X-ray. Options: Joseph-Schneever syndrome, Langerhans histiocytosis, Brown's tumor, Cherubism. Answer: Joseph-Schneever syndrome. Mesial marginal groove is present in maxillary first premolar, maxillary second premolar, mandibular first premolar, mandibular second premolar. Answer: maxillary first premolar. Bruchite is most commonly found in which areas of the oral cavity? Posterior mandibular region, anterior mandibular region, anterior maxillary, posterior maxillary. Answer: anterior mandibular region. Bilateral anteroposterior resection as classified by Harameni is class 1, class 2, class 3, class 4. Answer: class 4. Implant analog is mainly used for which of the following? Transfer, coping, impression making. It replicates implant in the cast. For surgical placement to maintain gingival contour. Answer: it replicates implant in the cast. Impression material of choice for the flabby tissue is irreversible hydrocolloid, agar, adhesion silicone, impression compound. Answer: irreversible hydrocolloid, that is alginate. Ratio of mesodistal width to height of the crown of maxillary canine is 60%, 80%, 70%, 90%. Answer: 80%. Most common cause of failure of implant retained prosthesis is screw loosening, implant mobility, peri-implantitis, prosthetic failure. Answer: screw loosening. Green strength is also known as dry strength, wet strength, compressive strength, tensile strength due to green in color. Answer: wet strength. Patient has undergone extraction of maxillary central incisor and wants to replace it. Which type of Pontic is indicated? Spheroidal, ovate, ridge lap, hygienic. Answer: ovate. A 4-year-old male patient with COVID-19 infection came to the clinic. After 2 months, the patient recovered from the disease. After that, he reported to the dentist with gnawing pain in the upper jaw and presented with elevated temperature as well as generalized swelling. For diagnosis, dentist took CBCT and the image is as follows. What is the diagnosis? Viral osteomyelitis, fungal osteomyelitis, bisphosphonate related necrosis, bacterial osteomyelitis. Answer: fungal osteomyelitis. In the case of unilateral distal extension case, removable partial denture, the indirect retainer is placed such that it is close to the fulcrum point on the canine. It lies close to the center of the tooth. It should be as far as possibly located from the fulcrum point. Answer: it should be as far as possibly located from the fulcrum point, that is away from the fulcrum point. Anti's law is related to selection of the abutment, selection of prosthetic tooth material, placement of indirect retainers based on pericemental area of the replaced and the missing tooth. Answer: based on the pericemental area of the replaced and the missing tooth. Which among the following factors is considered for the selection of the investment material? Type of the alloy used, type of investment material used, operator preference, melting point of the alloy used. Answer: melting point of the alloy used. A 57-year-old male patient has missing left lateral incisor, canine and first premolar. The most appropriate treatment indicated in this case is cantilever on second premolar, FPD, RPD, cantilever on right lateral incisor. Answer FPD. Cephalocaudal gradient of adult head to adult body is 0.12, 0.2, 0.3, 0.5. Answer 0.12. The given picture denotes subbuccal corridor connecting upper tuberosity and lower back arch, subbuccal corridor connecting the lower raphe to upper gum line, buccal corridor, suboptimal corridor. Answer buccal corridor. Image showing tooth movement with value of momentum 1200 with what is the moment of couple here? 1200 grams per millimeter clockwise, 1200 gram per millimeter anti-clockwise, 1000 grams per millimeter clockwise, 1000 gram per millimeter anti-clockwise. Answer 1200 gram per millimeter anti-clockwise. In which of the following analysis measurement of incisors is not done? Moyer, Stanley Gerber, Hakapa, Tanaka Johnson. Answer Hakaba. Plexus of Rashcow is found in cell-rich zone, loose areolar tissue, cell-free zone of Weil, odontoblastic zone. Answer cell-free zone of Weil. Ghon's complex is seen in which type of TB? Primary, secondary, miliary, intestinal. Answer primary. Paresthesia of lower lip is due to fracture of floor of the orbit, mandibular body, alveolus, zygomatic complex. Answer mandibular body. Antibacterial action of saliva is attributed to all except IgA, lactoferrin, lysozyme, aminopeptidase. Answer aminopeptidase. Which of the following drug is used in H1N1 infection? Amantadine, rimantadine, oseltamivir, enfuvirotide. Answer oseltamivir. A young swimmer has ear infection. Viewing on the otoscope, the patient coughs. Nerve irritated is trigeminal, facial, vagus, vestibulocochlear. Answer vagus. Patient has poor oral hygiene and on examination of the gingiva, there is rounded surface and lifesaver shaped appearance is seen in relation to the canines and premolars. This is called as Stillman cleft, gingival enlargement, widow's peak, Meccal festoons. Answer Meccal festoons. Lap sliding fit is provided in cast metal restoration. Gingival bevel is given at 20 degree to reduce marginal metal exposure by 0.05 to 0.02 mm, 20 degrees 0.05 to 0.01 mm, 30 degrees 0.05 to 0.02 mm and 15 degrees 0.05 to 0.02 mm. Answer is 30 degrees to reduce the marginal metal exposure by 0.05 to 0.02 mm. Less excess water is present in which of the following gypsum product according to ADA specification number 25? Model plaster, dental stone with high strength, impression plaster. Answer dental stone with high strength. Dr. Nancy Daily Bytes signing off. Thanks for watching. Subscribe for more videos and click on the bell button for instant notification.